Hi, I'm Dr. Mythili. I'm the lead gynecological oncologist at Aster CMI Hospital. Today, I'm going to talk a little bit about endometrial cancer. Endometrial cancer is the cancer of the lining of the uterus. The good news is that it can be detected in very early stages because it presents with abnormal vaginal bleeding even when the tumor is very small and confined to the uterus. The bad news is that as women, we tend to ignore abnormal bleeding until and unless it becomes very severe. So today I'm going to talk about when abnormal bleeding matters. Firstly, if you are postmenopausal, any bleeding is abnormal, whether it's in the form of spotting, heavy bleeding, or even just bloodstained discharge. Secondly, irregular periods, heavy bleeding during periods, prolonged bleeding, bleeding between your normal cycles, or bleeding following sexual intercourse, all of these are considered abnormal bleeding. While not all abnormal bleeding is cancer, the key here is to not ignore your symptoms. Please reach out if you have any of these abnormal signs of bleeding because you would need an ultrasound scan to see if any structural abnormalities are there in the uterus, as well as a biopsy of the lining of your uterus to clarify whether this is cancerous or not. This is not to alarm you, but to raise awareness about when bleeding is abnormal. So if you're experiencing any signs of abnormal bleeding, especially after menopause, please reach out to our gynec oncology team at Aster CMI Hospital for prompt and expert evaluation.